Okay, so now we're going to switch gears and talk about Botox. Botox is sort of an old and dear friend to me. It's only been approved, we tend to forget this, but this month makes 10 years since it was approved for cosmetic application. I've been using Botox since the mid-1980s. We forget, people don't want to attribute it to, but it was invented by an ophthalmologist in San Francisco. He was using it to treat eye muscle problems, and then later we used it to treat movement disorders. So I was using Botox when it was still investigational. 10 years ago, it became approved for cosmetic use. Dysport is a newer cousin of Botox. The beauty about Allergan 10 years ago was they applied for a cosmetic application, and they applied for it to treat between the eyebrows. And we can treat the deep furrows between the eyebrows. The beauty of that is, and we were using it for 10 years for that, or 15 years, or 20 years, we were using it for that. But then they applied for the cosmetic application, and once they got that, they could market it to you, okay? So no longer were they marketing it to us, they were marketing it to you. And that brought about an explosion in use for Botox. And everybody gets Botox, even your friends and neighbors, even if they tell you or don't tell you, okay, they are getting Botox, okay? You know, men get it, women get it, everybody gets it, okay? So, so it really is a great drug. It treats the lines between the brows, but we use it elsewhere. We use it to treat other lines in the forehead. We also use it to treat the crow's feet. And of course, most recently, they decided that they could use it to relieve migraines in certain patients. And that's also a very gratifying thing when we relieve chronic headaches. I guess I like Dysport a little bit better in the crow's feet. These two agents are very alike. Botox and Dysport lasts about 2 to 6 months. And it's something that it's a true lunchtime procedure. You can come in, you have it done, you go right back to work. Nobody knows you did it. Your husband doesn't have to know that you did it. Okay, it's just between your doctor and you. Okay, and it makes a big difference. It takes away the anger, you know, the creases in the forehead, and stops you from looking angry. So similar to Botox, but different than Botox, are fillers. Botox and Dysport work by paralyzing the muscle. And what that means is the wrinkles that are caused by facial expression, that's what you treat with Botox and Dysport. Fillers are different. You're treating static wrinkles with fillers. There are 120 fillers on the market. I remember, because I'm old, when there was just collagen, okay? And they've made such improvements in fillers, but despite the fact that there's 120 of them, they're much more alike than they are dissimilar. A filler fills out a wrinkle. That's what it does. And so even though there are so many, that's what fillers do. Again, it's a lunchtime procedure. You can come in, you can have it done, and probably you go back to work and nobody can tell that you had something done. There's lots of types of fillers. Without question, Restylane and Juvederm are the most popular fillers. They're much more alike, again, as I said, than dissimilar. They're actually made of exactly the same stuff. They're made by 2 different companies. So the companies want you to ask for Restylane. They want you to ask for Juvederm. They're pretty much the same thing. They last 6 to 12 months. Radius is something different. Radius lasts longer. I really like Radius in the nasolabial folds. It's not right for lip augmentation. Sculpture is a little bit different still. I think that it's a great filler to add overall facial volume, like I was talking before. Part of what happens with age is that we lose facial volume, so Sculpture can replace it. Fat, of course, is autologous. Obviously, it has the theoretical advantage that you get improvement in the donor side in addition to where we put it. But you're not taking that much, so it's not exactly the same as total body liposuction. It tends to be more expensive because it's an actual surgical procedure. So you're harvesting fat from one area, you spin it down, and then you transfer it to different syringes, and you do a micro droplet technique. And I think it has its best application for overall adding volume to the face. But it's not permanent. It probably lasts 2 to 3 years. The problem is there's a lot of swelling with it, and it's a little bit unpredictable as far as how much of the fat is going to survive. And finally, there's Silicon 1000, which is made by a medical company called Alcon. It is not approved as a filler. That doesn't mean doctors can't use it as a filler. And I think about 40% of doctors use it as a filler, and I'm one of that 40%. And I love Silicon 1000. I think it's fabulous. It is a permanent filler. So here's a lady who has beautiful lips to start with. She didn't want anything done with her lips, but she didn't like her nasolabial folds. So with just one syringe of radius to her nasolabial fold, you can see, now we can look at this relatively young person and say, there's not that much wrong with her nasolabial fold. And that's fine, but she thought there was something wrong with her nasolabial fold. So she comes in for this lunchtime procedure. We inject one single syringe of radius divided up between both sides, and all of a sudden her fold is much less deep, less prominent, less old looking, and she walks out that way. So it's a nice thing to be able to do for someone. So I would like to say that this is a patient that I did a filler on, because I'm talking about fillers. So certainly you could get this result with Restylane or with Juvederm. But this particular lady was 24, and she actually elected to go with lip implants. I used permafacial implant. If you look lower left, she's 24. She has pretty lips to begin with. I'm not saying she doesn't, okay? She wanted them to be augmented. So in the slide right, she has a more voluptuous looking lip, and lips, plural, and she felt that it was a tremendous improvement. And this is a very simple procedure to do. I've had tremendous success with these implants. It's quick, it's easy, and it gives you a permanent augmentation to the lip.